In this demonstration, we're going to be showing you SystmOne's Social Care product, which enables services to share vital information about a client with other clinicians involved in their care. With SystmOne's shared electronic record and in response to the increasing emphasis on integrated and patient-centered care, SystmOne is well placed to meet the government aim for an integrated health and social care record. We're going to follow a client journey which will allow us to see all of the functionality used within the social care module, from recording the referral, following discharge from hospital, to procuring services, and we'll see how different teams use the workflows within the system. So let's begin with the advice and screening workflow. Once we've securely logged into SystmOne, I can access the electronic task list, where we can view and action electronic referrals that have been sent to my service from other SystmOne organisations within the community. For example, here we can see Margaret's referral from hospital regarding concerns over her social lifestyle. As well as being able to accept electronic referrals like this, SystmOne also supports ERS, paper or email referrals that can then be added to the record or scanned in using the inbuilt scanning functionality. We can then review and complete the referral information with the configurable and reportable drop-down menus, whilst also having the option to add the client to a caseload for a particular team if required. At this stage, the client's SystmOne sharing preferences can be recorded, allowing for a share in and a share out of data for the client. Assuming consent will allow me to access the client's data-rich EMR, which can aid with decision making as well as saving duplication of entry. As part of the advice and screening process, I can then record the details of the contact made. Recording the contact methods such as telephone or face-to-face, and also who the contact is with, whether it be the client or the carer for this example. And I can then leave the contact open to be triaged. This is then viewable and clearly seen from the contacts list screen, where this can be picked up and processed. Here, I'm going to review the contact and then I'm going to close it and workflow it electronically to the relevant team. I can also record unknown contact, where the system will generate client details automatically and can then be matched at a later date to the client's record. So now that our client's contact has been workflowed, I can use the workflow screen to see all cases that have been sent to me or a group that I'm a part of. I can choose to update the workflows and keep a fully electronic audit of the tasks that I'm working on. eWorkflows functionality can also be used to manage tasks and workflows. They can be tracked and moved through the stages, whilst the progress can be monitored, including any timescales to be completed by, with the different outstanding workflows being able to be viewed in different visual formats for easy management. I can access the client's record directly from the workflow screen, and as we enter the record, we can see that a protocol has been triggered. Now, protocols are fully customizable within SystmOne and can be used for automated decision support, which can draw on information from the shared SystmOne record. In this case, I'm being alerted to a safeguarding concern, where the system will send a task message automatically to the relevant team for me. We can then view the tab Journal, and based on the client's sharing consents, I can access and view all of the client's shared record. Here I can see previous events within the social care settings, but I can also use the journal to filter by information recorded at the client's GP or other healthcare settings such as community or other teams. Where the client's GP is not on SystmOne, I can access the third-party record directly through SystmOne if configured to do so via GP Connect. During the assessment, I can book the client an appointment, and I can do this easily using the free slot search. I can select a suitable appointment slot within the social workers session, and I can then complete the booking. I can view this appointment along with any other booked appointments on the appointments ledger. Face-to-face appointments, as well as telephone or even video appointments, can be made in this same way. and I also have the ability to book visits where the contact would be at the client's home. Where multiple visits need to be booked and managed for clients within the community, SystmOne's Auto Planner can speed up this process by scheduling the staff members and visits required with just a couple of clicks. This will calculate the best possible routing whilst taking into account breaks and staff shift patterns. The communications annex within the client's record can be used to easily communicate with the client. In this case, I want the client to complete a self-assessment before they come for their appointment, which I've just booked. I can choose to send this by the client's preferred contact method, including SMS, email, or via SystmOne's patient portal, AirMid. Choosing to send the assessment to the client via email in this case, this will provide a secure link where the assessment can then be completed, filling in the fully customizable form. This is then received by the service for review and is filed into the client's record. AirMid is SystmOne's fully integrated client app, which is available for clients to download on iOS and Android, and is the same app used across any SystmOne Care setting. The service has full control over what is available to clients via AirMid. Here we can see AirMid from the patient point of view. We can see that a push notification has been pushed out to this patient for them to complete the assessment, and will be filed into the client's record in the same way as before. Here we can see that the client can actually view their assessments directly through AirMid. Clients can also book appointments, selecting from available appointment slots that the service has made available for online booking. Conversations between client and the service can also be enabled, reducing the need for telephone calls, and the details of the conversation can then be viewed from the client's record. And finally, video consultations can be carried out through AirMid with the ability to add multiple participants to the call. So we'll now look at how we can carry out the assessments, which can be done at site or at the client's home using our integrated mobile apps. When the client has arrived for their appointment, I can access the client's record directly from the appointments ledger. I can then also review the self-assessment that was completed by the client, in this case through the AirMid application. I can then add and access assessments and perform them from the record, which automatically links to the relevant questionnaire. As we complete the form, needs can be automatically derived, which can then support decision making later when procuring services. The assessment can also calculate a score and can also be used to add risks, which can then be managed from the client's record. The outcome of the assessment is then recorded, as well as the weekly budget. I also have the ability to attach photos and other supporting documentation. Here I can attach the photo of the driveway to help support rail assessments. Any equipment required can also be recorded, with the loaning of equipment being tracked within SystmOne. To support a strength-based approach to social care, SystmOne supports strength-based assessments that can be updated with or even by the client themselves. These can then be managed and viewed by the client and reviewed with those involved with the client's care. Here we can see the social worker completing the assessment within the client's record. This shared document can also be updated and added to by other caring parties, such as the client's GP or community services. The support plan can also be contributed to by the client via AirMid or online services. This could be using the same assessment tools as the social worker, as the questionnaire can be pushed out to clients for them to complete. The outcomes of the assessment are then combined to produce the support plan, with all of the items from the assessments populating via automatic merge fields. This document can then be viewed by all caring parties involved. SystmOne also supports the recording of DOLS applications within the client's record. Details of the authorization of applications can be recorded, including the conditions and details of the end date, and all of these fields are fully reportable. Finally, visualizations can be used to display and access information easily within the client's record. Here we can see a visualization that our customers have created for their CHC team to access all of the documentation and information that they need. For example, we can access various parts of the record from here and update. And now on to Brigid, SystmOne's fully integrated app for the social worker or the assessor. Whilst at the client's home or on the move, I have access to the client's record to view and enter data using my smartphone, with or without internet connection. After logging onto the app securely using my unique credentials, I can view my appointments and visits for the day, or for the rest of the week. I also have access to my client's full records, including the assessments that have been completed. I can view any clinical information such as allergies and medication. And I can also view documentation, for example, the client's support plan. I can also carry out assessments. So whilst at the client's home, I can select the assessment to complete. And again, doing this all through my mobile device. And finally, I can send communications to other teams. Here I'm messaging the safeguarding team to consider this client. We'll now look at the brokerage team functionality. Services required for the client can be added through SystmOne. Here we can see the type of services required, and I can choose to schedule this for the client or a relationship to the client, for example, for their carer. SystmOne supports a direct integration with Contract, where the indicative services can then be mapped to the services offered within Contract, confirming the delivery frequency and costings. I can then mark these services as approved to send the information directly to the Contract system via the integration. SystmOne supports the recording of safeguarding cases via a dedicated web portal. Safeguarding concerns can be reported by following the guidance and completing the form online. For example, a concerned relative or neighbour. Upon completion, confirming the details, the case is passed automatically to SystmOne and received by those users who have been granted specific access right to this dedicated screen. Details of the case can then be viewed, and I can choose options to match the case to an existing client record and also add any desired outcomes and supporting notes. SystmOne comprises a fully integrated reporting suite where client activity can be reported on, for example, quickly finding the number of assessments completed last week by a particular social worker, or the number of referrals that we've received last month for a particular service. We can then see the clients who match the criteria, and we can access the client's records from here, as well as applying any of the bulk actions to all of the clients in just a couple of clicks. For example, communicating with these clients all in one go. And finally, SystmOne provides a no-code platform to create, amend, and manage resources, including all of the data entry and output and workflow tools that we've seen in this presentation. Here we can see the assessment tool that I used before, and I can easily add a new answer to the options, which will instantly update for anyone using it. We also saw an automated protocol when I access the client's record, and here we can see that they can be created and amended, and these items form part of over 1 million pieces of content that have been created by our end users within SystmOne. And finally, letter templates can be created and amended, easily adding merge fields to pull information from the client's record when used.